NGT or Nasogastric therapy. It is a tube that is inserted through the nose, down to the throat and esophagus, and into the stomach. It can be used to give drugs, liquids, and liquid food, or used to remove the substances from the stomach. Who needs the NGT? NGT will be given to those people who are unable to eat or swallow food or any liquids.
Hi, I'm Shalami Tubio, and today I'm going to perform the procedure which is the nasogastric therapy.
Okay, so before anything else, we should know the patient's data first, such as name, birthday, sex, civil status, address, and most importantly is their vital signs. Next is to read the doctor's order about the patient's condition and the doctor's diagnosis to the patient. Good day, ma'am. I am Shalami Tudyo, your caregiver for 7 to 3 p.m. and I'm going to perform the nasogastric therapy as the doctor's order. So are you ready, ma'am? Do you want to defecate or urinate first? If no, then let me prepare the equipments for you. I'll be back as soon as possible. Assuming that I'm done preparing all the equipments and done performing hand washing technique, and make sure that you wear a gloves. So now I'm going to insert the Ngt tube. Firstly, get the towel to avoid messing to the patient's bed or dress. And next is get the Ngt tube. Okay, so roll the tube. Measure from the tip of the nose to the ear and ear to the stomach. Lubricate the tube 2 to 3 inches with KY jelly or water-based lubricant. Ma'am, I am going to insert now, and if you can feel that the tube is in your throat, kindly swallow. Then lock the tube to avoid entering unnecessary air. Secure the tube with a plaster or tape in the nose. And then check if the tube is in the proper place in the stomach using stethoscope and a syringe. Make sure that you lock the tube. Introduce air by pumping the valve. And if you can hear the gurgling sound, that means that the tube is in the right place. Next is using the gastric content. Remove the syringe and lock the tube. Pump the syringe into the litmus paper. And if you can see some changes of the color, something reddish, that means that the tube is in the stomach. Other option or ways is to submerge the tube in a cup of water. And if the bubbles are present, it means that the tube is in the lungs. But if there's nothing, it means that it is in the stomach. And make sure to lock the tube again. And after that, record the patient's data, time and date, the procedure being done, and the reaction of the patient during and after the procedure. So that's how to insert an NGT to the patient. Okay, so let's get into gavage or the feeding. So before anything else, we should know the patient's data first, such as name, birthday, sex, civil status, address, and most important is their vital signs. And then next is to read the doctor's order about the patient's condition and the doctor's diagnosis to the patient. Good day, ma'am. I am Shalamit Dio, your caregiver, and I'm going to perform the gavage as the doctor's order. Then get the tube and put the asepto syringe. Remove the valve and put 30 cc of water or plain normal saline solution. And then introduce 30 cc of water. Introduce 30 cc of water or plain normal saline solution. And okay, so do not empty the asepto syringe. Kink or lock the tube and introduce ensure 60 cc and let it down. Then lock it again and introduce another 60 cc of ensure. So introduce another 60 cc of PNSS or the normal saline. Then let it flow. Lock the tube and introduce 30 cc of medication. Remove the asepto syringe and lock the tube to avoid entering unnecessary air. And now we're done feeding the patient. And now we're going to record the time and date the procedure being done and the mLs or cc's of the water, ensure, and medicine applied. Then the reaction of the patient. Then let the patient rest for 2 hours. So we're done doing the gavage and now let's proceed to lavage. So before anything else, we should check the patient's data first, such as name, age, birthday, and most importantly is their vital signs. So read the doctor's order. Gravity drainage. So let's check the placement of the tube first. Introduce air, and if you can hear the gurgling sound, that means that the tube is in the right place. Introduce 60 cc of PNSS, then close, press the valve and let it flow, then lock the tube and remove the asepto syringe and pump the gastric contents into the kidney basin, then put it back again in the tube, remove the valve, introduce 60 cc of PNSS, then put it back again, then press and let it backflow. Okay, so lock the tube again and remove the asepto syringe and press the gastric contents into the kidney basin and put it back again into the tube. And then again, introduce 60 cc of normal saline and put back again the valve and then press and let it backflow. Then lock the tube and remove the asepto syringe and pump the gastric contents into the kidney basin. So make sure to lock the tube to avoid unnecessary air. Okay, so put the tube behind the pillow and get the forceps with a cotton ball and clean it around the mouth of the patient. So done. So now let's go to the removal of the Ngt tube. So get the forceps with a cotton ball and remove the plaster around the nose and clean it with a cotton ball. Then, okay, so done removing the plaster and cleaning the nose. Ma'am, in a count of 3, I'm going to pull out the tubes. Ready? 1, 2, 3. So make sure that the patient should not see the tube after removing it. And now we're done removing the Ngt tube. So now we're going to document and record the patient's data, the reaction of the patient before and during the procedure. So clean and remove the equipments. That's all, and thank you. Once again, I am Shalamito Jo, your caregiver.